A lot of adults deal with arthritis, and you see it especially in the spine, the knees, and the hips. So what can we do if we have knee arthritis to help get some relief in terms of exercises? We've talked about diet and lifestyle. You want to lose some weight, of course. You want to take some pressure off of those joints, right? And you want to eat a healthy diet, and anti-inflammatory foods. But what do we got in terms of exercises? Let's show you. So the idea here, before we show you, is to strengthen all the muscles around the knee joint, right? To support its motion and strength, to reinforce it. Also to strengthen muscles that go from the knee to the hips, muscles that sit around the hips and rotate hips, because there could be abnormal gait patterns or walking patterns in people that have knee arthritis because they're trying to compensate for that knee pain, and so subconsciously, without even knowing it, they're in a malposition when they're moving around, right? And this could cause dysfunction in other muscles, not just around the knee, but in the hip and things of that nature, right? So let's get into it. So what you got first, you need a few props for this. You know, you don't really need them, but what I would recommend is some rolled up towel, or if you have a pool noodle, that's good. If you have a ball, basketball, soccer ball, anything like that, you know, a little bit bigger the better, not a massive one that'll fit between your legs when you're laying on your back with your knees bent. You would like that, and a band, a resistance band would also be great, and a chair, right? Which you can't see, but it's off the camera right here. We're gonna take it out in a second. So first one is very simple, and this is the concept of strengthening the quad muscles, right? So what we want to do here is just, now I have a rolled up yoga mat, right? And that'll serve just fine. It has some compressive ability, right? And so, you know, it has some give, which makes that good. And that's why we said the noodle with the towel. So you're gonna lay down, and you're gonna take your leg and just put it right under your knee pit, okay? And just press down. Just press down and activate these muscles, these quad muscles, because we know that they extend the leg, right? Like that, the knee. So if we can just push down, we can push down, that's good. See really how many sets you can do of these without having extreme pain. Now, if you have a little bit of discomfort, guys, that's completely natural. You know, it's something that, you know, you can fight through, but if it's really sharp and it's really bothering you, just stop, okay? And if it's during one of the more advanced exercises, go to one of the more, one of the easier, more preliminary exercises that we're showing you here. So this is where we would kind of start, okay? So you got that. Then, next up, we're going right into a glute bridge. Very simple. And for these, if you want numbers to aim for, again, I like to go kind of to tolerance to see if you can strengthen them as much as you can and to progress over time. But, you know, even if it's just 3 sets of 10 of each of these, that would be fantastic, right, every day. So here you have the glute bridge, and you're just going to come up nice and slow. You're going to come up nice and slow, and you can have your head down. I like to keep it up to activate the core a little bit as well. And when you get to about neutral here, then you come down slow. Really the most important is coming down slow for these, more so than coming up slow. So you come up, we just don't want you jerking or, you know, making rapid movements like this. And then come down slow in that negative portion of the exercise to increase the muscle growth rates, right? And so in strength. And so we're going segment by segment as we come down here in the low back, and then we're planted, okay? So you got a glute bridge. Now while we're in this position, let's take our friend the band we got here. And what I did was I crossed it over and, you know, made it so that it'll be a bit more taut, make it more challenging. And I'm gonna put my feet through it, put it around my legs. So now we're going to do an abduction exercise where we open the legs and we work the muscles outside here in the hips and the legs. And so you're laying on your back for this, and knees about shoulder width apart, bent and push out. Now you don't have to go crazy and try to recruit other muscles. Just push to where you feel a lot of resistance. I would hold it there for a second, come in nice and slow. Nice and slow. When you feel the resistance go away, then push back out, okay? Now while we have this here, we'll show you some clamshells, which are great for the hip abductors, right? You probably feel this in your glute med, portions of the glute. What you can do here is you can prop yourself up in a comfortable position on your elbow, right? Now, if that's uncomfortable, you can get a pillow, you can lay on the pillow, whatever, but you know, I think this is nice. And what you're gonna do is make sure that these ankles stay connected, okay? Now, all you're gonna do in simple is you're gonna raise up. You should feel a squeeze back here in this back side of the glute, and then come down. Okay, so that's your clamshell, up and down. What do you not want to do? You don't want to rotate back. You don't want your body to come back. You're recruiting other muscles. You want to stay facing this way. When it gets to the point where you feel as though your hips are going to go back and point up, if you will, that's where you just go back down, okay? So you don't have to go past that point. I feel it just even doing that. Everybody has a weak glute med. I work on mine pretty regularly though. So we have that. Now, we worked the muscles that move your leg out, right? We've worked some glutes, we worked some quads, and now we're gonna work muscles that move your legs in, right? We call those adductors, okay? Now, I don't have a ball because I actually gave it to a patient to take home. They can do exercises, they'll bring it back, I hope. But they took my ball. I need to get another one. But I have this, it's foam, you know, whatever. It's decent size, it can fit between my legs, and it serves the purpose here. So you're gonna have your knees bent. I'm putting it between my legs. And very simple, I'm just squeezing them together now. So before we were pulling apart, now we're squeezing them together and relaxing, okay? Squeeze them together and hold it. So squeeze them together and hold. Squeeze, squeeze, squeeze. And very slowly release, but not to the point where it's gonna fall on you. Then go right back. Squeeze, squeeze, squeeze. And then release. And the last one we have on your back is another quad one, and a hip flexor, right? And so this is a straight leg raise. Now, why don't I have my legs both like this if I'm gonna do a straight leg raise? And how high should I go? Should I go all the way here, blah, blah, blah? Well, I bend the knee to keep my low back pressed to the floor. So I love to press that low back in the floor like this. And this is why I'm keeping my hands here, is because I like to, you know, take that curve kind of out of my low back and really activate my core this whole time, right? Which is helpful for so many things, including this. So keep that knee bent, the other one. This leg straight. If you can, dorsiflex the foot, meaning pull your toes towards your head, right? Then you're gonna bring the leg up and stop right where this other leg is. I'll show you so you can see right where this line is. That's pretty much where you want to stop, right? You don't want to overcompensate, recruit other muscles, start swinging anything like that. You're going to come up to here, go nice and slow on the way down. Good for core, good for your quads. So the other ones I'm going to show you are in a chair, which we got right here, baby. So how you guys doing today? I hope you're having a great day. I hope you don't have any arthritis, but if you do, hopefully these are helpful. So, you know, this one is very simple. You're gonna sit down, and you're just gonna have your knees bent, and you're gonna practice hip flexion here. Of course, landscapers are right outside now. So, they're on my porch, launching around. So you're gonna raise one leg up like this, just lift it up, and then slow on the way down. Lift it up, and then slow on the way down. And this is working those hip flexors, okay? So the next one is you're just gonna take that leg, you're gonna put it out straight, and you're gonna lift it up like this, okay? Like that. Okay, so here, let's bend it, and let's lift it up just above the other leg or about meeting that leg, all right? So those are two you're going to do sitting in the chair. And again, if you have severe knee pain, obviously stop, but if you can push yourself through a little bit of discomfort, that's a good thing that I'm completely okay with, because we want to progress you, right? So this one, you're going to hold on to the chair. We'll show you from the side. You're going to hold on to the chair. At least have your hands to balance. You don't need to if you can do this, without anything there. But what we're doing here is we are doing toe raises, and then we're doing heel raises. Okay, so we're working some of those dorsiflexors. We're working some of these muscles that come into the shin here, like anterior tibialis, whatever the names don't matter. But here we're working some of the calves, right? Behind the legs. So we're reinforcing everything above and below where the dysfunction is. And so it makes complete sense, I'm sure. So that's your next one, is simple heel toe raise. What not to do is don't bend and do it to compensate. Stand up nice and tall. Your toes can barely come off the ground, that's fine. And if you could do it like that, that's as well good too. The last one we got is a partial squat. So, this one I think is pretty easy, as was the other one. And you are going to, now you can do a full squat if you can do a full squat, right? But if you're not quite there yet, you could start here where you have the hands on. And what are you going to do when you squat down? Are your knees going to go this way? No. You're going to come down so that you can still see your toes. So what does that mean? It means stick your booty out, baby. Stick your booty out. That's what you're going to do. You're going to stick out the butt and come back like this. Even distribution of force through your feet. Okay, so not on your heels, not on your toes. And just come down partial squat and come up. Okay, come down partial squat and come up. Now if you can do that, you can get into full squats, right? And the same principle of sticking the butt out when you're doing them. Those are some good exercises if you have knee arthritis that can hopefully help to reduce your pain and improve function of the joint, among other joints, because they're helpful for a few different things. Who do we got on here? Let's say hi to everybody. And then we're going to go treat patients all day. It's great. We love it. Really do. Thanks, Ma. I love it too. MV Dillard. Floor, what's up, El Choi? James, Martello, no filter, Docs, Arrogance. Aaron, Discipline. How you doing, Kristen? Ashley, what's up, girl? Dave, be so nice. How you doing, brother? You don't have knee arthritis. That is good. You take good care of yourself. This is why. Malcolm, what's up, brother? Enrico Cash. Again, if you're late to the party, don't forget to lose weight and, have a lot of healthy whole foods from nature. That'll take a lot of stress off your joints. It's just something that would be good for most all of us in general, not just if you have knee arthritis, but as for now. So we got for you, folks. We'll see you tomorrow, baby. Not sure where, not sure when, but we'll see you then. Have an awesome rest of your day. Thank you so much. Happy Win Wellness. See you later.